Good morning. You're listening to the River Park Dental Show. I'm your host, Dr. Phing Saurer, here today with the one and only Michael Morris.
As opposed to, who else would be
Chuck
here?
Norris.
Oh, okay.
Again. That was my new opening. Did you like it?
I did, but I think you can't stick with that.
Yeah.
You got to change that.
No,
don't
it's
say
morning. It's morning.
It is morning for people who like Chuck Norris. So what's the latest with you? How are things? We ran into each other in the green room. You seemed kind of quiet today.
Was I?
Yeah.
I think because you were talking to other people.
Well, we did have another client in the room.
Client in there, so I didn't.
I felt like you felt jilted.
I don't like to interrupt conversations.
I feel like you weren't getting the attention that you wanted.
No, not true.
Okay, well, true. But everything else is going well?
Yeah.
You had a busy week?
Yeah, it was. It was actually good.
Did you get to dig in anybody's mouth? I know how you like to
Always,
do surgeries.
every single day.
Oosh.
I know. My favorite thing.
Yeah. And we're over 6 months now, right? We're open over 6 months yet?
What's today's date?
We can't say that, remember? We're all live on Facebook, but
yes,
we're
we are.
Always say yes.
I think we are right at the 6 month mark.
Yeah. And we should explain this. The show is live when we're doing it on Facebook Live, but on the weekends, you're hearing something we did a couple of days previous. That's why we never go, hey, it's so beautiful and sunny out, or
yeah,
go
but
Bucks.
remember, I did remember to say Happy Mother's Day the one time.
Yeah, but then we couldn't reuse that show, so it's fine. Wait, you said Happy Mother's Day to me?
Yeah, to
Thank
you.
you. Oh, that's right, you did. You did. This has, I hope someone watching on here looked at the caption where it says we're discussing dental implant
Yeah, they're like, when are we?
questions.
When
are they going to get to it? Well, just for
questions.
That one person out there, we will get to it. I just like to catch up and see how your week was.
2 minutes catch up. Let's go.
Yeah, I mean, but you were very busy, you told me.
Yeah.
And you were very pumped up.
Yes, it was an exciting week.
Website's up and running again. Everything is good.
Yes, we're doing a website redesign though.
Right.
And it's awesome.
I know what we have to talk about because
What?
I need people to see this. And I wasn't sure where they can see this other than like on LinkedIn and Facebook. Your twin, let's call them mini movies.
Yeah, it's going to be a series.
Yeah. So you're talking to Charlotte, your identical twin.
Yes.
Spoiler alert. That's really you
No.
on a green screen.
It is.
I know that you want to
So,
keep this rumor that there's another person that looks exactly like you.
You know how you didn't like me in the beginning?
I still
That's
don't like
you
you now.
actually met my twin, Charlotte.
Yeah.
And then you know how she left the room and then I came back in and
Yeah.
I think
people should understand that the first time we met, it did not go extremely well. You're bringing up some off-the-air inside stuff. The first time I met Phing,
I feel like your perception of it is completely...
Okay, well, you brought it up, so we're going to do it. So you wouldn't even look at me in the room when we're meeting to talk about...
I remember. I remember looking at your sweatshirt and saying...
I was dressed in a sweatshirt. It was 20 degrees outside. Okay? And I had just come from doing a radio show to come to talk to you about doing a radio show. And you're looking down at the table and looking out the window... and everything I say, you're like, but. And I'm like, I can't take this. I would like to leave. That's how we originally met.
No.
That is.
And then we tell the truth about the whole meeting.
Tell the truth about the whole meeting.
Not like that at all. It was very friendly, lovable.
So dental implant frequently asked questions. We're getting right into it. I know this is a hot button for you.
Wait, you were going to ask about my twin, Charlotte.
No, now I'm not interested. Now you just called me a liar. All right, we're going to get to implants in a second. The video that you put out.
Yeah. You can watch it on Instagram. I think it's going to be on YouTube.
I was going to ask if they can see it on YouTube because you have a lot of content of fun things you're doing in there that I've never seen another, not just dentist, but any physician do.
Yeah, we like to have fun.
But what I want to know is how you're getting it out there. Like I see the stuff you're doing.
Yeah.
But I think other people, if they looked at it, it is like next level entertaining.
Well, it's the one good thing. We have a good friend who's a videographer, and you've met him, Kojo.
Kojojo.
Yeah, and he's super creative. And then with Ellen being as creative as she is and us all meeting, we all come up with these great ideas. But it's nice that we can actually follow through and record these little like mini series or video
I just think
series.
it's amazing that you're talking to you. It looks seamless because I had somebody else, you said off the air that a patient asked you.
Yeah, about my twin.
And I had somebody else ask me that. I'm like, No.
Remember our friend Madison? He thought that was my twin
Shout
for
out
about
to
an
Madison.
hour.
Well, Madison, let's be honest. I mean, they're still putting the little bumper pool things up at the bowling alley frame. He's not the smartest whip.
Oh.
He's not listening.
Yes, he is.
No.
He's probably waving with his tan hands right now.
I bet he is. Madison was homeschooled. And that's not a joke.
That's not a bad thing either.
It didn't work out for him. But yeah, anyway, I thought that was a super creative thing that you guys did. And I think
Thanks.
you should find a way for more people to see it. I was just going to ask if it was going to be on YouTube. That's all.
Yeah, I think so. We're uploading all our videos on YouTube.
Depends.
That doesn't even make sense.
That's what you always say, no matter what. Depends. It depends on this. It depends on that.
In this context, that didn't even make sense.
Okay, so we've done our catch up for the week.
Yeah.
So we're so happy to get that over with.
Now it's time for the break.
Yeah. Thanks for listening to the show.
break.
Okay, let's get into some dental implants because
Okay.
we're running out of time. So dental implants are a big deal to you. Why? I mean, I know you like placing them. You like the actual surgical side of all this, right?
Yes.
And
And the restoration side. All of it.
So when you're looking at dental implants, I guess the first thing to look at is who is a good candidate for that?
So anyone who's missing a tooth, really, or has a tooth that needs to be extracted and needs to be replaced, then a dental implant is a great option.
As opposed to just leaving it?
Just leaving it, like if you extract it and then you have a space there, a missing tooth. What that does is over time that will disrupt function. So you're not distributing forces evenly. So your bite might be off, your chewings could be off, and then your teeth start moving into those spaces, and that changes everything. Your bite.
Does it move? Were you going to say occlusal?
Your occlusion. I was
Your
going to say that, but then
You thought I didn't know that?
no,
I
I
knew that
knew
term.
you would know, but like I don't know. Sometimes
Oh, your fans? Your public?
all 9 fans that are
All 9
listening.
listeners that love occlusions. The question I had about when you have that space, do your teeth move because it's trying to protect that area?
So I always say a tooth maintains the bone. So when a tooth is missing, then the teeth will start just drifting into that area. Sometimes that's how like orthodontics, they move teeth to kind of move bone with that tooth because bone will come with it. I don't know if I answered your question, but
No, you did. I was just curious about. There are some people that will put that off, and then that does affect their bite, which affects. I mean,
it affects a lot of things. And then with implants, what we do need though is good bone. So if you wait a long time and that bone shrinks because there's no tooth to hold it in place, it makes it a little bit more difficult. It doesn't necessarily mean that it can't happen, but it might just be a little bit harder. You may need to have bone grafting, a sinus lift if it's on the top, because your sinus will droop down in that space too if you're missing
Really?
a tooth. Yeah.
What is that part of getting the implant? Is that more of the advantages? You're keeping your bite the same. You're keeping your sinus cavity the same. I mean,
You're trying to keep everything the same. Yeah.
but how do you know when you get a patient in? Let's say it's somebody new that comes to you for an implant. How do you look at? You have to look at their previous records to see where their bone structure and everything is, correct?
You mean like it was missing when they came to my office?
Yeah, so you've never seen them, but they hear this show and they say, I want to meet your twin and I want an implant. You have to have some kind of patient history on them, correct?
Yeah. So if it's something that we need, we will request records from your old office. But we have a CBCT, a scan, a 3D scan, where we can just basically grab an image of your entire jaw, bone, look where the nerve is, look at where the sinus is. So we don't need previous records. We can just take the image in our office and then go from there.
That's got to be unlike most dental offices, because I thought when you changed the dental, who you were going to see as a dentist, I thought you had to have those files with you. Kind of like Patrick Swayze in Roadhouse. Another movie
I haven't
That
seen.
guy carried his files with him everywhere, every surgical thing. Is that not the case? Do you not need those? They call them jackets.
It depends. But normally I do not request records because I like to take my own records because a lot of the stuff is digital now. So for me to transfer non-digital x-rays into a digital office doesn't make sense, and I might not be able to read them very well. So I like to use the technology that I have. I will do it if they've already just recently had x-rays. I will do it as a courtesy. I'm not going to charge you extra when you've just had it, but it's just for us to have a good starting point.
Right. So you have to have a baseline for where their health was, their gums and teeth were beforehand, right?
Yeah.
So if somebody they could walk in and get an implant if they really wanted, but you have to get a history of where they were before they walked in and what caused that, right?
Right. Yeah.
How many people actually do that? Just kind of walking off the street like this, I need this right now. Or is it more of a long-term planning? Like I know this is coming out or I've lost it and I'm just going to be patient.
It's a mix of both. So I've had patients where it's a long-term plan where they know that this tooth has needed extracted for a while, but it's not causing them pain and they kind of put it off. And then I've had patients where they've sheared off the tooth completely at the gum line and it needs to be extracted and an implant placed. And I usually will try to place an implant immediately. So after the extraction, I place it directly into the socket, depending on the quality of the bone, of course, and any other factors, but that can be done. So you don't have that will reduce the amount of surgery time and the amount of time that you actually have to wait to have a crown on that tooth.
But also the recovery time too.
Yeah.
You didn't think I knew that.
Yeah.
I was just throwing that in there just in case you didn't get the triumvirate of it. I nailed it for you.
We've been on this show how many weeks now?
Too many.
So you're picking
Too many in a row. Yeah, but I do know some of this stuff. I have to do some research on this information. I mean, I can't just
read one article and you think you know everything.
That's 2 articles more than Madison. It's fun to pick on him on more than one show.
Oh. I am going to try to get him on our show, on this show.
How hard could that be? Wake him up and come on in.
Oh, poor Madison.
I know. He's not listening. What are the disadvantages of having dental implants? We've kind of talked about why you need them. What are the disadvantages of that?
I mean, infection can develop at times if you're not taking care of the crown or the implant. I mean, you always have to take care of everything that we're putting in. So infection's the only thing I can really think of.
Because basically, once they leave your office with that, it's up to them to maintain care.
Yeah. But I mean, when you come every 6 months for cleanings, we also monitor to make sure everything looks good too.
Do you also do the x-rays then as well? Like to see if it's growing the right way or if the bone is kind of attached to it or how's that?
Yeah, we definitely do follow-up emails, x-rays.
We send them emails. Sometimes we text them.
No, we do follow-up x-rays and we evaluate for sure.
And who does that? Is that more of a hygienist or you're actually seeing that part?
Well, the hygienist or the dental assistant takes the x-ray, but yeah, I look at it.
But you're the end-all be-all. Like, it's up to you.
I don't know what you're asking.
It's up to you to judge. What I'm saying is Missy can't look at it and go, yep, everything's cool, and then just clean your teeth and you're good.
You know, she has a lot of experience, so she has a good idea. But yes, I have to be the final look-see to confirm that's a real dental term.
I was going to say, I've heard that term before, but I don't know. I'm going to give you a look-see.
I'm going to take a little look-see here.
This woman has 2 doctorates, everyone. She just said look-see.
I just worked on a kid this morning, so maybe that's
Is that where you got it from? Children can also get dental implants at some point, right? There's a certain age.
No, certain age.
If their front teeth were to get knocked out, there's something that you can do. It's not necessarily they have to get implants.
I mean, I would either splint their teeth or you want their bone to be fully developed before you put an implant in.
I was just thinking about, we talked about mouth guards, I think it was last week.
Yes, you need to protect.
Emergencies. And I can't tell you how many kids I see out playing soccer that don't have mouth guards. And all I think about is like when you're holding a baby and it gives you that weird neck thing and they smash you right in the mouth. I keep thinking like. I
was wrestling with my 2-year-old 2 weeks ago and he kicked me right in the mouth. I thought there was like a panic attack. I thought one of my teeth, he
hit you like right square in the front teeth?
We were wrestling. So he just kicked. I mean, he didn't do it on purpose. Was it for the title
or were you just wrestling?
Because I was about to pin him, and then he kicked out. He kicked out right into my face.
Nice.
So, note to self: don't wrestle with your 2-year-old.
Well, you did say you have sensitive teeth.
That has nothing to do with
Well, I bet they were more sensitive. Is all I'm saying.
It was a little sore, but a tooth didn't come out.
This was George did that?
No, Benjamin.
Oh, Benjamin. Why do we care? I mean,
he's 2.
It was the other one. I'd be a little bit happier about it. Oh, Jim's got something.
George was waiting to tag in.
Yeah. He was going to get that hot tag and he was going to pin you. That's not good. Here's the key question that we keep coming across, and I want to know how you answer this question. How much do implants cost, and does insurance cover that cost? I know you love cost questions.
Yeah, cost questions. So
Well, let's do it this way. Let's answer this first of all. If someone needs them, is there any reason you would tell them to put it off?
no,
So cost is not a factor.
I don't think cost should be a factor. So another way to replace a missing tooth is with a bridge. So you essentially put crowns on the two teeth that are next to the space and you bridge it with another crown. So it's basically 3 crowns that are connected together. But the cost of that is pretty much the same as an implant. So I always say, if you can do an implant, do an implant. Because if you have a bridge, it's a little bit harder. And say the 2 teeth next to that space don't have any fillings or anything. They're virgin teeth. You'd have to grind down those teeth to put the crowns onto them to replace the tooth in the middle, and then to floss is very difficult
You're saying to
too.
avoid doing the implant, this is what you would do.
Yeah.
So there's a lot more involved, and the cost is probably the same.
The
or
cost
more.
is the same in long term. I don't think they last as well.
So your recommendation would be that the implant is the end all be all. Say it. Say depends. Please say depends. 'Cause I feel like I knew it was coming. There's just no way to avoid it. Depends.
No, there are certain things. So if you are diabetic and it's uncontrolled, the chances of the surgery doing well is decreased. Also, if you're a smoker, so you just have to. It depends on your health.
I love when it depends. Well, part of that you just kind of covered. One of the questions is, how long do dental implants last? A lot of that has to do with the care that you give your mouth, basically, right?
Yeah.
Don't just, I mean,
Yes.
like, you kind
Do you want me to elaborate?
I would like you to elaborate. Yes, you're correct.
Make sure you
I don't wanna
go
just
to
be
your
right.
cleanings every 6 months. And then, because we need to always check to make sure there's no infection or anything like that. No bone loss. So, yeah, I mean, implants will stay, though. And the thing about implants that I like is that, once you have an implant, you don't have to worry about pain, really, in terms of like a toothache because it doesn't have a nerve. And you can floss it like a regular tooth. So I actually have a dental implant right down below because I had a congenitally missing
Because of
tooth.
Ben.
No, he did not. It's Benjamin anyway.
Not to me.
I don't know who
We know
Ben
each other well. Little Benny.
So no, but I have one, and it just is like a regular tooth, and I floss it like a normal tooth. And,
When did you get it? Like, how long have you had it?
8-9 years ago, it was placed.
And what was the cause of that?
I just never had a tooth growing.
Ew.
So I had to go through braces, create a space to make a room for the implant, and the implant was placed.
You never had a tooth. It just never grew in.
Yeah, it was
So-
congenitally missing.
Don't use made up words. Wait, so
Now all my 9 fans know what that means.
yeah, they're going to be using that the wrong way later.
Congenital.
Hold on to that thought, congenital.
Okay.
We're going to take a break right here. Perfect segue. You're listening to the River Park Dental Show.
If your smile has a broken tooth or is missing one or more teeth, a dental implant may be a great option for replacement. Hi, I'm Dr. Phing Saurer at River Park Dental, and I perform all parts of this process at my office. I am the only dentist you'll need from start to finish. I am happy to offer a free consultation and show you how a dental implant can mimic the feel and function of a real tooth. Call us today at 614-689-8686 or visit us at riverparkdental.com.
Relax, refresh, and rejuvenate at the Cove Day Spa. The Cove Day Spa offers a variety of indulgent treatments and services, including hair and nails, as well as body treatments, facials, laser-like lipo, and so much more. Come see our new beautiful location on Roberts Road and consider booking a spa package today. Come to the Cove Day Spa and relax, refresh, and rejuvenate. To see all of our services we have to offer, go to www.thecovehilliard.com. That's www.thecovehilliard.com.
This is Gus Whiteside of Whiteside Chrysler Dodge Jeep, your mom and pop car store. The oldest Jeep dealership in Central Ohio. Dad started this place in 1960. It hadn't changed much. We offer a good selection of new and used vehicles. Whiteside Auto Sales is just minutes from Columbus and Grove City. No pressure, just great, transparent deals. 800-232-JEEP or online at whitesidecars.com. 800-232-JEEP. Remember, it's Whiteside Chrysler Dodge Jeep in Mount Sterling, Ohio.
I'm Dr. Phing Saurer, your dentist at Bridge Park. Have you ever been to a dental office and received bad news? Then you are told to see a different dentist with a different set of financial policies at an inconvenient location. At River Park Dental, once you become our patient, we won't ask you to see anyone else. My team and I are highly experienced and are proud to offer all services for you and your entire family under one roof. To learn more, visit us at riverparkdental.com. River Park Dental, where we practice tomorrow's dentistry today.
HouseTrends.com, the perfect place for you if you enjoy looking at beautiful homes and outdoor living spaces. Their stunning photos and articles focus on local Central Ohio residential building and remodeling projects with plenty of kitchen, bedroom, interior design, and landscaping ideas. You'll also discover exciting options in home design and furnishings. HouseTrends.com adds new content daily. Sign up to receive their online edition and check out past issues too. Go to HouseTrends.com and click on Columbus.
Welcome back to the River Park Dental Show.
Nailed it. Phing, we were talking about dental implants and frequently asked questions. We've gone over the simple stuff. Now it's time to really get into it.
The hard-hitting questions.
We had to take a break because I needed well rested
to
for
refocus.
This.
Okay.
So one of the questions here: dental implants dentures, can they be made into implants or dental implants?
They can be adjusted to fit dental implants. I don't know if I'm saying that correctly. So dentures, a lot of my patients don't like them because either they don't have a good suction, especially the lower ones, because your tongue is a very strong muscle and it can dislodge the denture pretty easily and it moves around and you have trouble chewing and speaking. So implants are great because they can stabilize the denture. And there's several ways to stabilize them, but you can either clip the denture on into place, so it clips, but you can still remove the denture. Or you would have implants placed where the denture can be screwed into place, and then
so it's not an either or. You could combine the two.
Combine
like a dent.
Well, you would only do if you decide to do a clip on, they would just be a clip on.
Okay.
But then that involves just 2 implants, sometimes 3. But if you want an implant, we call it hybrids, but an implant supported denture, you would need more implants to make sure that it's stabilized, so that you're not putting pressure just on the front, if that makes sense.
It does make sense. But is that a removable piece?
That is not. So that is screwed into place. And then, which people like because then they're not dislodging it with their tongue or anything like that.
I would think that people would want the implant versus the denture because of just they might come out, or, I would think when you see those commercials of people
for the Fixident.
Yeah, you don't want to eat anything ever because your teeth might fall out, and then all of a sudden you use that one product and they never come out, right? Whatever it is, Fixident or whatever. We might be talking about the thing that keeps your car door from being dinged. I think it's called Fixident.
The glue, yeah.
Yeah, but every time I see that, and the guy, he's not
chewing into his apple, like trying to bite into his apple, and it dislodges.
Like gnawing on a steak like a caveman is no big deal. That's what I see. There's those adhesive commercials, but then I keep thinking the money that you're spending long term to get the denture and then to buy the glue and everything else, you probably were better to do the implant in the first place.
I think so. I mean, it is an investment to have implant supported dentures, but I think it's a good investment. And it's just your quality of life is better, because if you just have traditional dentures, your bite force is so low. It's not like I think that's the thing that people have a hard time getting used to, is they'll say, this is not like my natural teeth. I'm like, but they're not your natural teeth and they move. So you're not going to be able to bite into things like you were able to.
Right.
With implant supported dentures, you will be able to at least chew a little bit better.
So how do those differ to get the, how did you say it? Implant supported dentures.
Yeah.
How's that different to All-in-4?
So, I mean, that's a similar thing, but All-in-4 is just a trademark name. But it's basically...
But I hear that said in a lot of, there are a lot of, whether it's TV or radio,
yeah,
whatever,
you use that. I mean, it's 4 implants that support a denture. So ideally, if you can have more implants, it's better. I mean, ideally, you would like to have 6. But sometimes the level of bone that you have doesn't allow for that. So you have to strategically place the 4 implants in a spread apart in a certain way so that the implant doesn't dislodge. And then you would just have the implant then screwed onto those implants. dentures screwed onto the
But
implant.
you're saying All-in-4 is a product, because I think what's happening is a lot of people are hearing All-in-4 and thinking 4 quadrants of your mouth. Top, left, right, bottom, left, right.
Is that, I don't know what people think, I guess.
Well, that's what I'm saying. If someone hasn't heard that before, because
So All-in-4, yeah. So if someone says you need an All-in-4 denture, it is placing 4 implants on the upper or lower. So that would be 8 implants. And then you would have the denture screwed into it.
how much does that cost? Is that the most expensive procedure for implants you can get? That is a lot of implants.
Hybrids. I mean, it is kind of like a hybrid, but ideally, if you can get more implants, especially in the back of the mouth, that's better. All-in-4s don't quite get to the very back.
Are they more cosmetic or functional?
No, it's functional. It's functional, and you know they've come up with different surgery techniques where you can angle the implant to try to make it go a little bit back further, and that's where the guided surgery comes into handy. Is helpful because when I do a 3D scan of your mouth, we have a software that can plan out how I'm going to exactly place those implants, the angle of the implant, all that stuff. So that's all pre-planned. So that and then we print out our surgical guide so that we can place those implants exactly where we want them, and then we would restore it.
Versus where you were before you had your own practice.
Well, I mean, freehanding implants. If
I
it's
didn't even ask the question. What about freehanding implants?
you can. I mean, I think it's better to have it be guided because then you know exactly how you're placing it. Sometimes though, for example, if I'm doing an extraction and a placement of the implant, it's kind of easy because the socket's right there. So it's not like there's not much guesswork that's involved with that.
But how long do you have to wait? So you've done the extraction. How long do you have to wait before you
Place the
place
implant
the implant?
that same day.
Same day, but you can't take one out and put it in right away.
Yes, you
Right.
can.
Really?
Yeah.
I know it's same day. I know that you like to say same
I
day.
love
get
same
that.
day. Yeah.
Well, it depends. But when you do that,
So they leave with an implant in their mouth, and then I let them go and let it heal for 6 to 8 weeks,
and then they come back
and then they come back. We do some checks, follow-up checks in between there, but yes.
by email. You said that. So I did not know you could do that.
Yeah.
I thought you had to extract it and let that heal, but it's probably
You can. So that's the traditional way of doing it. The immediate placement doesn't work all the time because it depends on your bone. The buccal plate, the buccal bone, if that
Sure.
breaks off, then it's probably not good to place an implant there. The quality of bone, sometimes it's really infected and then I won't place an implant there. I'll put a bone graft in to let it heal and then place the implant later. But if the quality of bone is good and the buccal bone is there, you can put an implant immediately and leave with an implant. And sometimes, especially with a front tooth, if it's sheared off at the gum line, say because you were wrestling your 2-year-old and he broke your tooth,
he probably beat
and
you.
it could be saved with a root canal, I can extract that tooth, considering all the bone is good, place an implant in there, and then actually put a temporary tooth in there, and you'll leave. I mean, it's a surgery. It takes some time, but you will leave that same day with a tooth.
I got to tell you, the show always starts off with the intro and it's a little bumpy, and then you really bring the heat at the end. That was really good.
I liked my intro today. Good morning.
I'm gonna give it a 6 out of 10. But that was amazing. Like I found myself
Thanks.
really riveted by what you were saying.
Yeah, I actually felt like you were listening to what I was saying this
What's
time.
But we've run out of time. That's the only thing. We're out of time for this week. We're gonna talk more about implants just because I know you love them.
I do love them.
Yeah, and you love surgery.
I do.
Gross. So we're gonna talk about that more. But why don't you sign us off for the week?
You want to wait?
No, you just gotta say goodbye.
Thank you for listening to the River Park Dental Show.
There you go. Nailed it.
You've been listening to a Morris Media production.